Hey interns, I'm Dr. Chris Raynor and I am not your everyday ortho. As many of you already know, footballer Christian Eriksen collapsed on the pitch at the Euros yesterday during Denmark's opening match with Finland. He was immediately attended to by paramedics and medical staff, given care and taken off the field. Currently, we know that he is in hospital recovering and awaiting more tests. He has sent a message to his fans, so that is a great relief. A few people have asked me to comment on this, and so I thought I'd share my thoughts about the event and talk a little bit about why this might have happened. To be clear, this is speculation only. We don't know for sure yet what exactly happened or why, but I think it's fair to talk about some of the possible reasons for the education of other athletes and the public in general. This type of thing can happen to anyone. Sometimes there are reasons beyond your control, and sometimes there are things that you can actively do to prevent such an event. I want you to keep in mind the concept of layers here. That is to say, layers of things going on that when piled one on top of another can sometimes create such an unfortunate event. As pro athletes typically push themselves to the limits of their bodies, sometimes these layers can stack up. For example, they will play injured or sick, they will push past the point of being exhausted, they will do things that regular people just won't do. With that in mind, let's talk about some of the reasons why Eriksen may have collapsed. There are a number of potential reasons for sudden cardiac arrest in athletes. The most common cause for collapse in athletes under 35 years of age are congenital or inherited problems. There are 7 or 8 congenital problems that give you an abnormal heart and might cause this to happen. But the most common causes of an abnormal heart are hypertrophic cardiomyopathy and an anomalous origin of a coronary artery. With hypertrophic cardiomyopathy, the muscle of the heart wall is larger and thicker than it normally should be. With an anomalous origin of a coronary artery, the blood supply to a portion of the heart muscle originates from a location other than where we would expect it. Both of these problems can lead to inadequate blood supply to the heart itself when it is working hard and desperately in need of blood. As I mentioned, layering of effects, the demands on an abnormal heart at that given time could have been too much for the heart to handle. In athletes older than 35 years of age, the abnormal heart causes tend toward acquired atherosclerotic coronary artery disease, which just means buildup of plaque in the arteries of the heart from things like poor diet, high cholesterol, excessive alcohol consumption, or just living and getting older. In general, the causes can be grouped by whether or not they occur in a structurally normal or an abnormal heart, and whether or not they are congenital or acquired. Most often, an abnormal heart is involved, as mentioned above, with only 30% of athletes having any symptoms of problems prior to the event. However, you can have a structurally normal heart and still experience an event such as this. Remember again what I said about layering. Add too many issues together and you could induce a problem such as this. Things to think about: environmental factors, such as if there are super hot or super cold conditions, or if a person has ingested some kind of substance, drugs, stimulants, or possibly even pre-workout. Even a blow directly to the chest and heart could cause something like this to happen. Sometimes simply electrolyte imbalance could be enough to cause an arrhythmia, especially if there are other factors at play. Eriksen's club has strongly denied that Eriksen had recently been vaccinated for COVID or that he had contracted the virus. However, it is important for athletes who may have had the virus to know that COVID has been associated with cardiac abnormalities that persist for some time following recovery from the disease. Recovering athletes should be aware of this and should adjust their workouts or training accordingly. At this point, the cause is not yet known. Let's make that clear. I am not suggesting any particular cause for what happened to Eriksen. I am simply giving you some reason why it may have happened. If you are an athlete, there are things that you should pay attention to. Make sure that you have enough water. Don't take any pre-stimulants before your activity. If it's super hot and if you don't feel well, don't push yourself to the max. Fortunately, Eriksen was revived on the field and noted to be alert and responsive while in medical care. Subsequent investigations will give us more clarity as to what occurred and, more importantly, how to avoid it recurring again in the future. Thanks for watching and subscribing. As always, that's been a word from Dr. Chris, not your everyday ortho.
Just a flesh wound.